And welcome back to Wisconsin Doctors. We're so excited to be here at the Fort Healthcare Wound and Edema Clinic in Johnson Creek. And it's been great because we're learning a lot about different types of wounds and how they're healed and different practices like that. And now we're going to be talking with Dr. Robert Goldman, who is the medical director here at the Wound and Edema Clinic. Welcome, and thank you for having us.
Thanks, it's a real pleasure to be here.
Yeah, absolutely. So we're going to talk a little bit about diabetes and limb preservation. So first I want to ask, how does having complications of diabetes lead to the risk of wounds, obviously, and then limb loss?
Well, Mary did speak to this before. The big thing that we talked about was neuropathy or problem with nerves. And that is absolutely huge. People will have a tack in their shoe and not know it, and they'll pull out and they'll have a wound. What happens is that the nerves they're toxified, if that's the right word, by the blood sugar increase, especially nerves that are long that go from the spine down to the foot. And what that does is it leads to the nerves dying, and then the muscles that the nerves go to also die. So you have more bones in the foot sticking out and increasing pressure, and can lead to ulceration. When an ulcer does occur, people with diabetes have more difficulty healing it for two reasons. One is the white blood cells and the immune system don't work as well, so that they tend to get more and deeper infections, harder to heal. And then the last one is they tend to get, as Mary said, calcified arteries. These arteries tend to be more lower down in the leg, which are harder to get to. And the combination of things, you have less oxygen, you have less active white blood cells, and you have more problems with pressure. And so these wounds tend to get really bad relatively quickly, and they demand a lot of challenge in order to heal them.
Now, you talked a little bit about nerves dying. Is that something, I mean, is that permanent? Like if the nerves die, can they ever come back?
Not for this. Usually for this, they do not come back.
Wow. Okay.
No.
Wow.
So, Dr. G, can you explain to the viewers what kind of, that if they have limb loss, what it means to society in general?
Right, so the idea is that, how big a problem is this? It's actually a huge problem in that, especially for people with diabetes, in that diabetics are 50 times more likely to get a lower extremity amputation than are people without diabetes. And by amputation, I mean an amputation below the knee, maybe a few inches below the knee. And when this happens, patients with the limb loss are more likely to be not around, pass away at 5 years than be here. In other words, it's a 50% 5-year mortality, which is higher than a lot of cancers. Now, it's also because of all the other disease burden that they have along with the diabetes, but still, these are very troubling numbers. So we want to try and preserve limbs, not to mention improve quality of life and the fact that everyone wants 2 legs.
And I want to make sure that viewers understand that you said that they, if they have diabetes, it's not that they're 50% more likely to lose in a lower extremity, they're 50 times more likely to lose a lower extremity.
They're 50 times more likely to lose a limb. That's 50 times.
Like 5,000%.
That's right, as Mary was saying, like, a lot of different things lead into this.
Wow, wow.
So Dr. Goldman, can you tell us what kind of progress has been made in taking care of the diabetic leg and foot wounds?
Sure, well, it turns out that in the past 12 years, the number of leg amputations has gone down by 60%. And that's a really encouraging number. And
yes.
it has to do with, as people suspect, better management of diabetes, better control of blood sugar, more people getting primary care, better management in terms of medications, better understanding of diet. And I would add to that is something that we've been just talking about, is foot management. People having the right kind of shoes, the right kind of padding, the right amount of room in the toe, changing them every 6 months, having somebody inspect them, dealing with calluses, and overall just keeping that happen can prevent ulcers. So there is an improvement.
Wow. And as I understand it, the wound clinic here has some things that they can do if someone is heading in that direction of maybe the possibility of losing a limb might be growing for them. You guys have some ways of maybe reversing that a little bit or helping to prevent that. What can you do?
Right, so what we can do here is we can bring to bear a plan to help that patient. Okay, so we have various different specialties, and we form a team. And we're all under one roof, and we talk to each other under one roof. so that the different parts of the team are the wound care doctor, who's like the leader of the orchestra, the conductor, dealing with all the other elements of the team. There is the nursing, which deal with all the nursing supplies and control of teaching the diabetic patient what to do. That's absolutely critical because the patients are not going to do it if they don't understand it.
Right.
There's also a weight relief plan, we'll call it a rehab plan, where people have to off-weight one way or another. And that's very important for healing diabetic foot ulcers. And that's another part of the team. Another one is a surgeon. It could be a podiatric surgeon, an orthopedic surgeon, or some other surgeon, because a lot of these folks have deep infections that need to have some cleaning of that area, maybe even involving some bone loss, perhaps, I'm sorry to say.
Right.
When that happens, you can actually take off a toe if you have to in order to save a limb.
Yeah.
And then you still can walk.
Right.
So then there's another one is that if you get a deep infection, there is a special antibiotic doctor, infectious disease doctor, because they need antibiotics for 6 weeks. And that's a medical issue for the specialist. And lastly, there's the vascular doctor. So we talked about hardening of the arteries. So you can do a procedure like people get on their heart, which is like a cardiac catheterization. People are familiar with this, where they actually put little tubes down there and they have balloons.
Sure.
And they can get rid of blockages in the heart. Well, they can do the same thing in the legs. And you can go all the way down to the feet to do this. And this is probably one of the biggest advances in the past 10 years, is improving minimally invasive revascularization, which we use a lot, and it really does improve things. Also in our clinic, we have hyperbaric oxygen. So you have a very rich oxygen material that goes to the wound. It uses the white blood cells, it makes them more effective, it tends to kill bacteria and get more oxygen in the wound to help it heal. So that actually also promotes limb preservation. We have a whole criteria for this. We're pretty effective at that, and we have some really good results. And so you put that all together, and we have a way to really make this happen. It takes more than, it takes a village, and that's us.
Yes, you're the village. Well, Dr. Robert Goldman, Medical Director of the Wound and Edema Center here at Fort Healthcare, thanks so much for joining us.
You're welcome. Thank you very much.
Don't go away. When we come back, we'll learn a little bit more about diabetes management and education. Stay with us.